Welcome to our very first podcast episode of Coffee Chats with Claire. I'm beyond thrilled to introduce our first incredible guest, Dr. Kara Yeung, who is generously sharing her time and expertise with us today. Dr. Yeung grew up in the Bay Area. She went to Stanford University for her undergraduate education, where she received a bachelor's in science and environmental science and a minor in biology. She then completed her medical education at Harvard Medical School, residency at the Harvard-affiliated Emergency Medicine Residency Program, and will be completing her medical toxicology fellowship at UC San Diego early this summer. I'm so happy to have you here. Let's break down our conversation into 3 parts. First, we'll dive into your current role and responsibilities, getting a glimpse into your daily life as a medical toxicology fellow. Next, we'll take a step back and explore the journey that brought you here to where you are today, highlighting twists, turns, and lessons learned along the way. And finally, we'll wrap up with some valuable advice and insights that you can share from me and our listeners. Does this sound okay with you?
Yeah.
Perfect. So first of all, please tell me about your current role at the fellowship at UC San Diego and some of your other responsibilities.
Absolutely. Thank you for having me on the show.
Of course.
The way I sort of break down what I do on a day-to-day basis is sort of 2 different hats. And so the first part of my role is basically working in the emergency department as an attending physician. And so what that means is after all of the training, I work essentially in the ED, and if it's with trainees, so that's can be medical students, residents, then I would be the supervising physician that's sort of on shift and working with them and taking care of patients. If I'm alone, and let's say in a different hospital, then essentially I'm just working with the medical staff taking care of patients. So that's one role. This other role I have is the medical toxicology hat. And essentially my job as a fellow is obviously it's additional training with the goal of becoming a full toxicologist. Afterwards, there's sort of board accreditation and things that go with that. But essentially, it's a deep dive into understanding sort of pharmacodynamics, therapies, drug overdoses, how that impacts the human body. And so that kind of comes in different flavors. And so there's the clinical aspect, which is taking care of patients who are affected by overdoses, drug side effects in the hospital. The other part of it can be research and doing sort of the rigorous clinical research or other sort of data analysis to look at these sort of epidemiology behind a lot of the patient populations that experience all of this, which is quite a lot. On a day-to-day, it would be more like doing a lot of education. We have a lot of rotators with us on our service. And so essentially that's trainees, medical students, residents that come and learn with us on a sort of day-to-day basis. We have a consult service, and that basically is like a phone a friend. And so if there's somebody in the hospital that needs sort of expertise, opinions, they can consult the toxicology service, and we can help them out when it comes to patient care. So those are the sort of 2 hats that I wear, and it alternates sort of on a weekly basis.
That's fascinating. Do you think you can walk me through a very typical day in your work and some of the most common tasks that you tackle?
Yep. So the first would be what it means when I walk in on shift when I'm doing like a regular emergency medicine shift. And so emergency medicine is nice that it's shift work, and so you sort of clock in, do your work, and you clock out. And so when I come on shift, depending on the time of day, oftentimes there will be a prior doctor who will be sort of like, quote, signing out to me. And so they'll be wrapping up all the patients that they've been caring for, and then they'll hand them over to me to continue the care. So I'll take those. And then otherwise, like because it's the emergency department, it's 24/7 open, 365 days a year. So anybody who comes in with any sort of medical complaint, they'll check in and I'll see them, and then I'll order any testing that I think is necessary for them. I'll update whatever is going on and then basically treat. And we call it disposition, which is then sending them where they need to be. Do they need to be admitted to the hospital? Do they need something else done before we can, move to the next step, or can they go home? And so
Right.
that's that. And then once my shift is done, it's sort of a rinse and repeat. I will also wrap up my patients. I'll sign out what I have done for them and then give it to the next provider who will take over for me. And then I go home. On the other hand, the toxicology aspect is a little bit variable in the sense that a lot of it revolves around education. So that's going to lectures, listening to expert faculty who are very much versed and experienced in the field of toxicology and their teaching. We also, as fellows, teach a lot too to the rotators, and it's sort of like a classroom setting. So you meet in like
Right.
a conference room of some sort and you teach. The other times is that I'm running around in the hospital seeing consults, and so that's just on a sort of random basis. And so if I get called, I'll go and see the patient at the bedside, do my assessment, talk to the primary team, and then kind of wrap it up. And then as far as seeing them again, we'll do something called rounds, which is a pretty
Mm.
common feature in medicine, which is then seeing them usually the next day to see how the patient is doing. And then we'll either adjust our recommendations or we'll sort of close our case as there's nothing more that we need to do or offer from a talks standpoint. And then we'll kind of move on.
When do you think you wake up, and is there like a typical time period of where you're working, or is it very flexible and fluctuates?
So working in the ED is notorious for there is no set time. Like it's not
Right.
a typical 8 to 5 type of time frame. So the ED, because it's 24/7, your shifts can be any time of the day. And so it's kind of just distributed amongst the staff that are available. They try to do it equally. And so it typically in most departments, across the country, it's like you have a day shift, which is like you clock in at 6 a.m., 7 a.m., and
Mhm.
then it's about 8 to 10 hour shifts. And so then you'll check out in the afternoon. And so then there's an afternoon person. Oftentimes there are people that sort of are in the like we call it swing shift. So that's in the evening or twilight hour. So that could be anywhere from 4 p.m. to 2 a.m., 5 p.m. to 1 a.m., something like that.
Wow.
And then there's a night shift, which is just your typical overnight hours, 10
Right.
p.m. to 7 a.m., something like that. The
Wow.
the toxicology teaching is during the day, so that can be more of a 8 to 5 hour business hours. But otherwise, the consults can happen any time of the day. So I could be called at 4 a.m. in the morning to go
Wow.
see a patient. It can happen.
Mm-hmm. Let's switch gears and talk more about your journey towards your medical career. Where were you for high school, and then when did you know that you were going to go into medicine?
Yeah, so growing up in the Bay Area, I went to a small private school. It was Crystal Springs Upland School. And essentially, I was there from sixth grade to 12th grade. I was there for quite a bit of time. But essentially, I definitely did not have a sense of medicine in high school, going into college. Like, I knew it existed, but for me, I knew broadly I liked the sciences, and so going to college, I knew I was going to major in some shape or form in that field. It just didn't sort of come into fruition maybe end of sophomore year, I would say.
Mhm.
So the end of second year of college. So that I was sort of jumping all over the place. I initially wanted to do marine biology and sort of do more research and PhD work, but essentially, hence the environmental science major. But I think I got really interested in medicine because my passion for the environment and I care a lot about how that started to affect humans and their health. That sort of got me back into considering medicine as a potential career.
Right, right. What was your major in college, and were there any classes that inspired you to go into healthcare?
Yeah, so the actual name of my major is called Earth Systems, but most people don't really know what that means. And so it's essentially an environmental science major. You can sub specialize in under different categories within that. And so mine tended to be more like biology, ecology focused. But essentially, in terms of classes, I think a lot of the seminars that are more specific and I quote the random, those were the ones that actually got me really interested. Like I remember taking, and it was just pure like for fun. It wasn't required for my major or anything, but it was on like a parasitology class. And I still remember it
Oh,
today. And I thought it was just like the coolest topic ever, where basically you learn a lot about different parasites and how it can mess
oh
up your
wow.
body. And I thought that that was a really, really interesting topic,
That
which
is.
inspired me to be like, medicine can be really weird. And I feel like I found that to be very intriguing.
Mhm.
But at that time, I still wasn't really interested in medicine, but it's still like, even to this day, I still remember it. That one was definitely one that has influenced my perception and guided me sort of back to medicine.
Mhm. If if you knew that you would be here now, do you think you would switch your major back in college?
No, I definitely think college, it's so flexible that you can pursue any sort of major that you want as long as you do sort of all the prerequisites that are required for applying to medical school. You
Right.
essentially can do that and integrate it into any major that you want. And so you do not have to always major in like biology or bioengineering, those sort of like neurosciences, all of those science majors, unless you're passionate about it, then I think it's very reasonable. But the beauty of college is to explore and
Mhm.
sort of follow your passions. And then you can always do the foundational classes as needed.
How about after college, when you went to medical school, do you think the transition was pretty challenging, or were there any rewarding moments as you transitioned?
For me, I would say it may have been more easy compared to some of my other classmates in the sense that I didn't take a year off between graduating from undergraduate and then going into medical school. So at least for me, as in terms of how I learn, is that I sort of need to keep the momentum of
Mm.
learning and sort of that sort of academic environment. And so it's like very familiar, which is graduate, take a summer break, and then start school again. And so that just felt very familiar. So the transition itself, the only tough part was obviously moving across the country and getting things all sort of situated. But
Right.
that felt very much like college and moving into a new school. And so that felt familiar and just do and kind of meeting everybody all over again. As far as like classwork, the challenges of transitioning to that is it feels like you're taking almost like super souped up challenging classes on particular topics in medicine, which can be a lot of information. And so that's probably the most daunting part of it. And obviously, it's in a different environment with different people. And so that I think was one of the more challenging aspects when when I transitioned to med
Mm.
school.
Wait, tell me more about that. Was there a particular subject that you found was like a whole dump of information or something that
Um,
really.
I think for everybody, everybody has different strengths and weaknesses, and so it just depends on what topics you like. Because within medicine, there's so many specialties, so there's a lot of different topics within it. So, for example, like the topics that I grasped more easily were some of the more physiology based. So that would be like cardiology, heart stuff, pulmonology, renal. So all of those sort of came for some reason a little bit more easily to me because I could conceptualize it. But then when it's like genetics, for example, which is all
Mm.
like probability and math and things, like it's never been my strong suit. And so that was like something that I was like, oh, gee, okay, I have to like actually put some more work, and it was a bit challenging. And then statistics, that one is also something that like I know I have to learn to understand a lot of research and things like that, but it wasn't something I was passionate about, and so that one
Right.
was also sometimes hard to get through because I just needed to learn it, but I wasn't that enthusiastic about that topic.
Hmm. And in particular, what do you think motivates you the most or inspires you the most to pursue a career in medicine?
I think so. It's hard when you're sort of in the weeds, actively training or doing education in medicine. But I think when I was thinking about this question and reflecting back, I found that what has always drawn me to medicine and has sort of kept me going and makes me want to wake up every day and go to work type of feeling
Right.
is that I've always enjoyed the clinical practice of medicine. And so for me, I went into emergency medicine because I like the practical aspects of medicine. And so emergency medicine sort of encompasses that. And so that's basically knowing a little bit about every sort of topic in medicine, a more sort of more breadth, not depth type of specialty. And so being able to sort of know all of, I kind of like highlights, like the need to know for a lot of different emergencies within each topic and knowing how to treat it. That for some reason is very satisfying to me to like be able to have that sort of skill set. I like doing procedures to the point of not necessarily operating like a surgeon in the ORs, but I do like having skills to do procedures if I need to on a
Right.
patient at the bedside. And then honestly, it's you meet a lot of different people that you probably not necessarily may encounter on a day-to-day basis. And so this sort of environment just allows you to just meet people from all walks of life and in different points of their life. And I think that that's really interesting to sort of just meet these people, learn a little bit about their life, just like glimpses of it, but then ultimately trying to help them feel better on sometimes one of the worst days of their life. And if I could just help
Right.
them a little bit on that day, like that, that to me seems like it feels more fulfilling to be able to do that,
Hmm.
at
So
least on a day-to-day basis.
you find like socializing, interacting face to face with your patients, like one of the leading factors of why you like your.
Yeah, I think that it's a spectrum for a lot of different people. And so I think to have a little bit of it. So emergency medicine, it's more efficiency. So obviously if you have increased efficiency, you may decrease on something else. And so
Right.
if it's to see a lot of patients and it's very busy, you may have to decrease the face time. But basically it sort of pushes me to be able to take what the time I am given and try to maximize the quality of time, even if it's very little. And I find that to be an interesting challenge
Mm.
when speaking with patients. But if it's a little bit, it's a lot of FaceTime and it's a little bit sort of every kind of sprinkled in the whole shift. And so it can add up to be a lot in general, but just maybe snippets for each patient.
And also, let's dive deeper into toxicology. Why did you choose that as your specific field of science that you specialize in?
Yeah, so that one is interesting where I think it wasn't until 2 years into residency training that I decided that I would pursue a fellowship in medical toxicology. But essentially, part of my interests are sort of twofold within medicine. And so, emergency medicine is sort of like the foundational clinical medicine that I practice. But then within that, I sort of have interests within it. And so the two essentially is that part of my like hobbies and other things that when I've grown up is that I love animals and the environment. And so toxicology has sort of helped me dive a little bit deeper into basically bites and stings or envenomations is what we call it. And so a lot of animals do possess poisons, and if they bite you, they are venomous. And so that's just one interesting niche topic that I just find really interesting and am passionate about. And that sort of is a topic that toxicology can't cover. And pursuing the fellowship would allow me to sort of have time to pursue those interests. The other aspect is, again, the practical aspect of medicine that I was drawn to, which is understanding a lot of how drugs work, how drugs interact with each other, and then sort of what happens to the body when it's exposed to drugs, either at the right dose or too much of the dose. And
Mm.
I find that has definitely helped augment my knowledge in terms of understanding a lot of pharmacodynamics and pharmacology in general. And I have found a lot of that to be applicable to my like actual practice of emergency medicine. And so I felt like I was sort of double dipping where I was doing this fun fellowship that allows me to pursue this like niche topic that I like, but at the same time it's giving me like such a broad, eye-opening like exposure to like very nitty-gritty drug related topics that I can still use on my day-to-day practice in the emergency department.
That makes a lot of sense.
Mhm.
That's like a double, how do you say that?
It's like two birds with one
Yes,
stone in a
exactly.
way. Yeah.
Exactly. Um, how about in when you are in challenging situations, how do you handle and contain yourself and um, like handle high pressure situations with uncertain outcomes?
So the field of emergency medicine is pretty much encompasses that on a day-to-day basis. A
Right.
lot of other specialties, they come in a little bit of sort of different flavors, but emergency medicine is sort of your very, very much the pinnacle of making very rapid decisions with little information that's given to you about a patient when they're like actively either dying or decompensating in front of you. And so that is something that just is it's exposure, experience, and training. Nobody comes into medicine on day one being able to possess the skill set to just handle that on day one. Like nobody does that. So that's where medical training, both from the medical education perspective and then training further in residency, that's what prepares you to be able to handle these situations. But I think it also comes down to people's personality. So some people are very much more calm and collected on the outside, but then they're like feeling a whole bunch of emotions on the inside. Then there's some people that are the opposite. They're like very much have a lot of high energy on the outside, but they are very much steadfast on the inside. And so it's something that I think can come naturally to a lot of people, but training and experience makes it easier sort of every time you go through something like that. And honestly, I feel like because medicine is a team effort, the emotions and sort of the energy you give off is very much palpable to a lot of other people.
Hmm.
And so that's one of the first things to sort of learn how to regulate and control is the energy. And so that's been something that you sort of hone in as you and craft as you pursue careers that demand that sort of like high pressure environments.
So would you say now you're more like calm and collected when you're handling these situations?
Yeah, I mean, I feel like because my job demands that of me, it's
Mm.
always something that it's already sort of been drilled in me. There's always something that will certainly throw me off, I'm sure, but that's the aspect of it is when that happens, how do you handle it? And essentially, it's a lot of self-reflection and self-awareness that sort of allows someone to be able to know how to control all of that and then basically either debriefing or chatting with someone that's like very close that you are very much can trust them to sort of
Mhm.
understand and process all of those emotions, and then with time it gets easier and easier.
Yeah, having someone to trust is must be really important. For the last part of our conversation today, I'd like to ask you for some advice. What advice would you give someone in high school like me who is interested in pursuing a career in healthcare medicine?
I would say high school is sort of the first gateway into afterwards kind of figuring out what you want to do in life. But it's like the very, very first step. I would say the most, I think, simple way to think about it is just keeping an open mind about all sorts of different aspects of one's career choices, whether it's medicine or something else, because I have found that things always can always change, or the paths that you envision can always take a turn. It may still end up on the same original path, but it's always something to keep in mind. Like I probably would not have imagined that, like, all of the thoughts that I went into in terms of how I got into medicine from my original mind or time in high school, I probably wouldn't have predicted that. And so it's usually just keep an open mind, follow your gut, whether it's your gut or your heart. And then essentially, there's always so much, I feel like, pressure externally, both from like your mentors, from your parents, from your friends, just like peer, like what everybody else is doing. And if it's really hard, because I think it's just something that in high school we're all just like constantly surrounded by. But if you're able to sort of tune all of that out and stay sort of true to what makes you want to get up and out of bed every day, what you feel like excites you when you're sort of envisioning your future, stick to that and
Mm.
just ignore what everybody else is saying unless it's something that you truly feel is like a helpful tip or things like that and you believe in that. But otherwise, if it's something that you just feel it's just straight pressure, I would say take it with a grain of salt.
Okay. Is there anything that you yourself would do differently looking back on the path that you've taken?
I think this maybe applies more sort of down the line, not so much in high school, but maybe college and on. But because the road to medicine is it's very long. It's a marathon, not a sprint.
Mm.
It is very much emotionally and physically taxing at times. I would advise it would just be nice and something that I would do in the past if I would go into the past is just to be more present in sort of the moment on your day to day sort of life. To be able, like, yes, you always have to be forward thinking and planning, what you need to do in the next few days, months, years, etc. I think that's part of life. But the other part is to enjoy being with like your friends and your family, like currently in the current environment, because that's something that you won't get to relive again. And so, and in each stage, like high school, college, medical school, you're going to meet so many different people. And I think that that's just something to be present for because they developing these sort of unique relationships. And these will be people that will in some way, shape or form alter sort of your outlook in life or they'll augment your friendships. And I feel like I wish that I had spent more time sort of in the moment with all of these people
Mm.
and had more time also with like my family. But because I was training so far away, it's not something, I don't think it's something I would change. But with the time that I did have whenever I was visiting home or things to just be more present with them, I think that's something I would have changed.
Thank you. That's very helpful. Thank you. To conclude, I want to extend my heartfelt gratitude to you, Dr. Young, for sharing your journey and insights and expertise with us. Your dedication to the field of medical toxicology and emergency medicine is truly, truly inspiring. So, thank you for being an amazing first guest.
Yeah, and thank you so much for having me.
Thank you. And for our listeners, thank you for tuning in onto today's episode of Coffee Chats of Claire. Join us another time for another great conversation. And until then, take care and stay curious.